we are. 3, 2, 1. Hello. Welcome, Discovery Center visitors, viewers. We are so happy to have you join us today to talk to these two fabulous physicians and have them answer a few of your questions. My name is Laura. I work here at the Kansas Children's Discovery Center. I'm our Director of Marketing. And today I'm going to be helping facilitate some of these questions on behalf of our Discovery Baby program, which is one way we connect parents to resources here in the Topeka and Shawnee County community. So we're very pleased to be joined by these two physicians. We have Dr. Nelson with us. Can you wave, Dr. Nelson?
Hi.
Dr. Nelson. And we have Dr. Grammatikopoulou with us as well. Give a wave. These are two fabulous physicians we've worked with a lot at the Discovery Center. Pediatric Associates has been a very generous sponsor of the Discovery Center for a long time. There are two programs that the practice sponsors. One of them is Medical Warriors, which is our program that makes the museum accessible for children who are medically fragile, immunocompromised, and need special accommodations to visit the museum. The other program they sponsor is Puzzle Pieces, which is our program specifically for children who have an autism spectrum disorder and their families. Typically, that museum program invites those families to the museum free of admission charges on the second Sunday of every month from 11 to 1. Of course, now that the museum is closed, we're not offering that, but we have brought that program online. So parents who have used that program in the past should definitely check out kansasdiscovery.org/puzzle pieces to have a whole wealth of resources. We have videos and all kinds of great things that committee has prepared for those families now that we're all online and trying to figure out how that works. So Pediatric Associates sponsors those programs, and they also help us in a lot of ways. They've written great blog content for us before, and they're joining us today for this live. So these two pediatricians are the brave ones today. They have agreed to answer your questions live here on Facebook. So if you have questions, post them down here in the comment section, and we will be sure to get those answered just as soon as we can. I thought I would start out, and of course, if there's anything else you want to say to introduce yourselves, feel free. But I thought we could start out just by talking a little about what parents need to be thinking about going into summertime with kiddos. What are some things you're encouraging parents to keep in mind while we're getting those questions from the public?
Okay. Yeah, and I can start with, I think I'll talk about, kind of insect/bite situations and, how to deal with them, how to deal preventing them, and how to deal treating them. And then I think Dr. Nelson is going to touch on like sunscreen and, sun protection. So as far as, bug bites go, so we kid around here and we say that, wintertime is kind of flu and viral illnesses, and summertime is, accidents, injuries, and bug bites. So we see a lot of those during the summertime. Prevention-wise, so we don't even get the bug bites in the first place, we usually recommend doing something, an insect repellent that has an appropriate amount of DEET in it to protect enough for, usually it's mosquito bites, but it can be chiggers and other things too. So something like a Deep Woods, insect repellent that has about 25% DEET in it is perfectly fine. I usually recommend spraying the clothes and not the child. So I usually say before you go out about 15 minutes before you go outside, spray the clothes down, let them kind of air it out a little bit, and then you can put it on the child, and you can go outside pretty safely that way. So that's a good recommendation. For people who want to do a little bit more kind of natural stuff, there's a lot of natural insect repellents that have like citronella and other things in them, and that's actually a pretty good option too. There's little bracelets and stuff like that are usually also, have citronella in them and other natural ingredients that are naturally insect repellents. So that's another option for people who want to do that and don't want to spray their kids down. So these are some good options. As far as like treating goes, most of insect bites, don't need any major treatment. Most kiddos do perfectly fine. They last for a couple of days, they go away. There are kiddos that react pretty significantly to insect bites. So you'll see some kiddos have big welts around the insect bite, usually mosquitoes more than anything. So typically I say for treatment of those, I would talk to your pediatrician to just kind of make sure, we're not having, extreme discomfort there. Sometimes we'll do a topical steroid, and it's easy to send that out. Even the over-the-counter hydrocortisone a lot of time is perfectly fine. Or doing a little bit of Benadryl, so we're not messing with it and irritating it more. And then as far as infection goes, sometimes those bites, if we scratch them enough and get them super irritated, we can introduce bacteria there. No major infections, typically just a mild local staph infection. So starting out with some Neosporin in the areas where you see open areas in the bites, that's probably a good start. And then if it's not getting better, you just talk to your pediatrician.
And I always tell people that remember that chiggers crawl and mosquitoes fly. So open skin is where the mosquitoes are going to go and the chiggers are going to crawl. So I always spray the shoes really well because they're going to be crawling right up the leg.
Okay.
As far as tick bites go, which is a thing that we see quite a bit over the summertime too, it's important the two major things are how long has the tick been on the skin. So typically under 48 hours and definitely under like 24 hours, usually the tick has not even started a meal yet. So typically there's no huge worry of transmitting something like Lyme or something like that. I always say over the summertime, every night when your kids dress in pajamas, for example, which is a good time where they're nice and naked, just go through their body and check the body very carefully to make sure there's no ticks or anything like that. Creases are good areas to look at. So make sure like bottom of the neck right here, armpits, between toes, groin area, things like that. Make sure you look at those areas very carefully behind the knees. Those are areas that you have to take a look at. And then again, appropriate removal of tick is very important too. So usually I say tweezers, and you have to grab it flush to the skin, so where the mouthpiece is, and you have to pick, kind of abruptly and straight, so you don't break the tick and you create like sometimes a bloodbath. But yeah, so you have to grab it close to the mouthpiece, flush to the skin, and just pull straight and up.
And don't burn it ahead of time or anything.
No, you don't need to do any of that.
It'll regurgitate its stomach contents back into the person and more likely cause infection.
Exactly. And that's why we recommend to not grab it from the body, because any stress to the tick, if you're squeezing it from the body, it can actually, again, regurgitate its saliva and stomach contacts into the skin and create more of a problem than anything. So, yeah.
And then the sunscreen talk is pretty brief. I mean, it's always best to have cover on. But if you're not, and it's unavoidable, you should put on some sort of, child sunscreen. I like water babies, but any kind is fine. It says on there not for under 6 months, but really they just don't want your babies in the sun. So if it's unavoidable and your baby's under 6 months, it's okay to go ahead and use some sunscreen.
And again,
short and sweet.
Yeah, exactly. And again, most sunscreens that are safe are based in zinc oxide. I mean, this is what we use in diaper areas too. Yeah, so if it's a zinc oxide based, it's pretty safe to use even in smaller babies. So, that should be totally fine.
And I think
one question.
Can we go ahead and answer?
Sure. Yeah. It looks like we do have a good one here from Katie. And I'm glad Katie asked this question because I think all parents are wanting to know this right now. Let me see if I can get her pulled up on the screen here. Katie is wanting to know, should my 2.5-year-old son, 2.5-year-old son, I guess I should read that as, with asthma, wear a mask if we are around others? What age should wear them and what health conditions should not, if any, is the remaining part of her question. So I know a ton of parents have this question right now. And of course, this varies a lot depending on family and children. What general guidelines can you give not only for Katie, but for other parents who are out there wondering about mask use for kiddos?
Really, if you're over the age of 2, you should try to wear a mask. Now, not every kid is going to be able to keep it on, so really you got to do the best you can.
Yeah.
Mask wearing does not interfere with asthma, although if your child is having some sort of an asthma reaction and having trouble breathing, then you probably should not put a mask on.
Yeah.
But at all possible, you should put them on just to protect them and to protect others as well.
Yeah. And it really depends on the maturity of the child. So a 2.5-year-old, there's a huge variety of, maturity levels there. So a lot of 2.5-year-olds are perfectly, mature to be able to keep the mask and wear it and stuff like that, and do fine with it. You don't have to fight with the child. If they're not putting the mask on, there's no point fighting it. The mask, again, a lot of times we kind of keep repeating this. The mask is to make sure you don't transmit anything to anyone else. It will partially protect you from getting something too, but it's mostly not transmitting. So if this is a kiddo with asthma and we're worried a little bit that it's a higher risk kiddo, if everyone else around the kid is wearing masks, I think that's pretty good. Also, if you can move the interactions with relatives and stuff like that outside, that's also a good way to deal with things, so that masks are not that they're not necessary, but you reduce the risk by moving things outside, and if people kind of can stay not shoulder to shoulder, ideally. So if you're doing all these things, and everyone else around the kiddo is wearing masks, I think you're at a pretty good place.
I know my 2.5-year-old, and I have a 2.5-year-old as well, Katie, so I feel you on this. He has a hard time when we put the mask on, and he gets very excited about touching his face. He just wants to touch everything on that mask. And so I found myself wondering, is he better off without it since he can't keep his hands off of it, or does it still provide some protection?
I mean, I think it would provide some protection. Everybody just kind of got to do the best they can.
Right, exactly.
Yeah. I mean, even adults are messing with their masks, so it just happens. Lots of hand sanitizer.
It's true. I think an average 2.5-year-old will do at least as well as most of us adults are managing to do. Well, we have another great question here. This is from Jessica. Jessica says, I have a baby due soon, and I am wondering what your suggestions are as far as keeping a newborn safe during the pandemic. Really tough situation. I'm sure there's some stress involved for Jessica. What can you do to help her out, docs?
This is a great question. And I'll tell you that in the hospitals, all of my new moms and returning moms have said that there's no visitors being allowed into the hospital rooms. So actually their hospital stay was very quiet, which is kind of nice. At home, I think it's going to be the same precautions we would have with anybody, nobody with symptoms, nobody with fever. I would just be very protective and kind of cocoon that baby as much as you can.
And I would say, I'm sure with newborns, I get this question at the newborn visits all the time. So can grandparents see the baby? Can, uncle and aunt see the baby? Can cousins see the baby? And I think adult relatives are a lot more careful, I think, again, because they're adults. So I think for a newborn and just early infant, because we know that these kids probably will get a worse brunt of the illness if they get it compared to older kiddos. I would say I would be very careful. So anyone who comes around to see the baby, adults especially, should be wearing a mask and should wash their hands really well before they touch the baby. Ideally, I wouldn't even have them touch the baby if they can help it. So they can look at it, and stuff like that, and talk to it and stuff like that with a mask. But if they want to touch the baby, which again, grandparents and stuff like that, I can totally see that. I would wash hands really, really well. And of course they have to be zero symptoms, and not have come in contact with anyone before, that is suspicious. And then wash hands really well. And I think that's pretty safe. Now for younger relatives and things like that, so like cousins, things like that, it's a little bit tougher depending on the ages of the kid relatives. But again, I would think the same thing. So make sure all the kiddos are wearing masks, and for the kids especially, I don't think they need to be that close to the baby. So they can, see the baby a little bit from a distance maybe. So it's a hard situation, and family dynamics play such a big role in this, I think. But I would definitely keep it on the safer side, and like Dr. Nelson said, cocoon the baby as much as possible.
Virtual visits.
Yeah.
Online.
Yeah. And I mean, exactly.
Oh, so we'll have so many babies who are familiar with Zoom by the time this whole thing.
It's true.
Jessica, that is a great question. And we have a lot of other great Discovery Baby programs. One I'm thinking for you, and I'll try to drop the link in the comments when I get an opportunity, specifically on Jessica's comment. Sally Wright from the Discovery Baby programs did a really great interview with her daughter who recently had a baby and her son-in-law about their experiences. I believe the baby was born a couple months ago, just giving birth during COVID, handling a newborn, that kind of stuff. She did a whole interview with them that was really great information, and has them sharing a lot of their experiences and tips and tricks and things they learned along the way. So I would recommend that interview as well if you haven't seen that already, and I'll be sure to drop that link in the comments. So check that out. We have a great question here from Kathy. Oh gosh, I wonder about this every year, but especially this year. How careful should we be about kids sharing food at outdoor picnics, etc.?
Oh, this This is an interesting question.
Yeah, that's a little bit of a toughie, I guess.
I think if everyone's washing their hands and everyone's doing what they're supposed to be doing, it's probably not any different than any other year. I think it's all about hand hygiene.
I agree. And again, if the question is, targeted towards more like COVID, compared to other, illnesses, in its nature, COVID is not a foodborne illness, so that's why, even the CDC and stuff like that, they say that it's okay to get like deliveries from, restaurants and stuff like that, because it's not technically a foodborne illness. So again, as long as your hands are clean, so you didn't like cough into your hand and then like touch the food, I think you should be good. Again, I think there's a lot of research being done on this. Now they're saying that, COVID has been, probably seen in stool of people, but that doesn't necessarily mean that it's a foodborne illness. So again, I think just, hand hygiene, and ideally, again, this is all in an ideal world, I would, not share as much, it's harder to do with the littler kids, but if they're older kids and stuff like that, I think they can be convinced to not share. But all in all, I think hand hygiene is pretty much number one.
I think as parents, I think we need to be even more diligent about not sending our kids to daycare and to schools when they have any symptoms. I mean, I know it's a pain if your kid has a cough and a runny nose, but that's the only way to keep this from spreading, is you've got to keep those kids home who are sick. And so then theoretically at the picnic, everybody should have already had their temperature checked. They should be wearing masks if they can, except take them off to eat. And then they should do good hand hygiene. And then that's pretty much as best you can do.
And again, COVID is one of those sort of like upper respiratory, lower respiratory infections. So it's going to be in secretions like saliva and stuff like that. So when we say sharing food, I'm not entirely sure what we're talking about, but I would definitely not take a bite and then like give someone another bite, because, 2-year-olds will do that, or share drinks, for example, because there's definitely like saliva there. So I wouldn't do these things, but like having a sandwich and cutting in the middle and like stuff like that is fine. But yeah, anything that has spit basically on it probably should not be shared.
There we go.
So as a parent of young children,
not just due to COVID.
Yes. As a parent of young children, I'm just going to say my advice is anytime a 2-year-old, 3-year-old brings you a snack and wants you to eat it and you haven't seen it go to the packet,
avoid it.
It is a no. No drink sharing.
Yes,
Mommy takes this are the most dangerous words in the English language. You've got to be careful about that.
Yes. And basically it's what you would do with a kid that's sick with flu. You shouldn't be sharing anything with them, or strep for that matter, I mean, and again, the age of the child here matters a lot, because I've had my kids at home when they were little, where they were like, one of them was sick and they were sharing like a lollipop, and I'm like, oh dear. But so you kind of have to be careful. I mean, again,
my kids still drink after me.
I know,
Instead of getting their own water, they'll drink out of my water cup. It drives me absolutely crazy.
So these things you probably should be more careful about, but otherwise, hand hygiene I think is pretty much number one here.
What are some tips you have for encouraging good hand hygiene with kids, especially little ones, when we're first teaching them how to wash their hands? Do you have any ideas for some fun ways to do that are engaging for them and exciting for them? Hand washing is so important, and kids just love to skip it. How can we encourage that to get better?
Yes. So I have one thing that I saw lately that I think was very smart. For the littler kids especially, you have like fun little stamps, and you stamp their hands and you tell them to see if they can wash it off.
Oh, that's a good idea.
So with that, they and because like 2-year-olds and stuff like that are pretty competitive a lot of times. They're like, oh man, I've got a task in hand, so they become pretty like almost like obsessed about doing that. So and it's like stamps and it's fun, so they become committed and it's a visual reminder. So it's good because it's there. I have to wash it off. It should not be there anymore by the time I'm done. So that's a nice way that I've seen some people do it. So
there's also many fun songs. It used to just be ABC or Happy Birthday, but they've gone through and picked out a bunch of more recent songs that you can sing along, and so it keeps it more entertaining, I think.
We at the Discovery Center, briefly before we had to close, we filmed a version of Baby Shark about hand washing that wash your hands, do, and goes on with the different verses and goes through the steps. We still have that on our YouTube channel, so check that out. That's another one maybe I should drop.
Nice.
I don't know if it works for kids, but we had a blast. One other question we've had a lot of parents ask recently, kids' routines are shaking up so much. Sleep seems to be getting harder and harder between the routines being all fouled up with the end of the school year. And now, of course, we have light later in the day. What are some tips for how much sleep should young kids get during the summer? Is it okay to push back bedtimes? What are some tips or ideas you have around sleeping for kids?
It is okay to push back bedtime as long as they're still getting an appropriate amount of sleep. And I don't know, I can't remember exactly the hours per age. We have a chart in our rooms. I think it's important to try to keep as much of a routine as possible. Now, of course, we've all pushed our kids back because we're staying up later. But I think you just need to realize they still need that routine. They can't stay up all hours on their electronics. You still have to have some sort of a schedule. You're going to have some crabby kids.
And nobody needs crabby kids. That's important.
Nobody needs crabby kids.
Yes. And I agree with Dr. Nelson entirely. So as long as they're getting the amount of hours of sleep in 24 hours, they can do it in segments over the summertime. So they can sleep, the most amount of hours should be at nighttime. And then they can take a couple naps during the day to kind of accumulate the amount of hours that they should be sleeping. So roughly for a 12-month-old and above, so through elementary school, really, it's about 12 hours total. Right? And then adolescents and stuff like that, between 9 and 10 hours at total. So roughly, if they're getting that, I mean, it's okay. It's okay. Everything's a little bit, looser and more lenient over the summertime. So, they enjoy the family more. The days are longer. I think it's fine.
If you get off schedule and you want to try to get back on, it's easier to increase or get them up about 15, 30 minutes earlier than they have been. And then you just back their bedtime up by the same amount of time until eventually you're back to the normal time that you'd like to be. Okay. And I would do this at least a couple of weeks before hopefully school resumes in the fall to get them back on track.
Yes, absolutely. And that's getting tricky. I know, parents, that's tough. Those of you who are having hard times with bedtimes, I see you, I feel you. It has been real in my house with a 5-year-old and a 2-year-old, but we're muddling through and we'll just keep at it. A reminder for our folks who are watching, we have a lot of people tuning in. The docs are here to answer your questions live, so post those in the comments and I'll get them passed along. One question we had that came in via Messenger from one of our Discovery Baby families, she is working on introducing solid foods and was curious what your thoughts are on getting babies accustomed to that and what's critical for parents during that very important developmental milestone.
How old is the baby?
That's a good question. I don't know that from the Messenger question.
I'm gonna go so typically we say start solid foods between 4 and 6 months of age, kind of depending again on the maturity of the kiddo. They can have good trunk support, their head is nice and steady and things like that, and they seem to be interested when their parents or siblings are eating. They're looking at the food, trying to grab it, things like that. They're ready to start solid foods. The experience of starting solid foods might not go, for some babies it goes fantastic. Right. They're on it and they do great. For some babies it's kind of more of a challenging time. So a lot of times it will be super, super messy and they'll spit out most of it and they'll make faces and, it will take multiple efforts, days on end of efforts to kind of actually, understand the process there. I mean, it's a completely different oral motor skill to drink liquids and then do something more textured than that. So again, it's a big difference. And some kiddos, especially kiddos who are more sensory inclined, do have a problem with that. They're like, okay, this is completely different texture. I don't like this. So there's no magic or nothing, really, fantastic or a skill that you have developed. It's just basically persistence. So, I usually say that's why we say when you start off with solid foods, do pretty liquidy, soupy kind of solid foods. So even the stage 1 foods, if you look at them, they're pretty soupy. I mean, they're not really creamy, so that's the first thing. Make the texture more close to liquid food than anything else. So usually the cereals should be pretty soupy. And then if you're going to make vegetables and fruits, blend it, put a little bit of water, breast milk, or whatever else you're using to make them looser, basically. And once they get used to that texture, you kind of increase the texture a little bit with some cereal, or you just make it thicker until they kind of get to the point where they're okay with more solid foods. That's pretty much, the process that we usually go through.
I tell people that I really only have a couple of rules. The one rule is you have to introduce foods about 3 days apart. So you're going to introduce the same food for 3 days before you go to the next food. And the rules are relaxed about whether it's a fruit, veggie, or meat. You can pretty much do any of them you want, as long as it's one at a time. And then my other rule is, by the time they're, between 6 and 9 months, you should be introducing things as long as they can handle, like peanut butter, eggs, all that kind of stuff. But the absolute that they can't have is raw honey. So no honey before 1, and then one food about every 3 days or so. Otherwise, it's very relaxed now, the feeding schedules.
And that's kind of a change. Is that right, Dr. Nelson? I'm remembering even between my oldest and youngest children, when I had my oldest, it was still no peanut butter for a very long time. And then by the time I had my youngest, those recommendations had shifted. So for many of us parents, it's hard to keep up.
Yeah. They have found in other countries that use a lot of peanut oil, the amount of peanut allergy is very, very low. And so the thinking was, and it makes sense, that we should introduce things sooner and to prevent allergies from developing. When my youngest was a baby, we also were told, fruit or veggies first, then fruits, then meats. But there was really no rhyme or reason why we did things that way. So it's much different now.
Yeah. And the same goes for other like allergenic type of food. So like eggs and stuff like that. Now we're okay to introduce earlier. Usually after 6 months of age, we say, go ahead and, introduce those. So right now.
We are always learning and always growing, aren't we? That's great. We have another question that came in on the Facebook from Kimberly. Kimberly has another question I know a lot of parents are wondering about. She is saying, would you recommend to continue keeping kids at home, avoiding public places, stores, playgrounds, etc.? Or do you think it's safe to start venturing out with them again?
I think stores or anything that's indoors is always going to be a little bit higher risk. If your kid is going with you to the store, they really should have a mask on. Ideally, you'd leave them at home. Now, outside to playgrounds and to parks and stuff, it's probably okay. As long as there's not a bunch of crowded people, they can run around and play. The sun is shining. They should be fine. I don't think we need to all stay inside, but we just need to be cautious about where we're going.
Right. I only say venture to places that you think are almost absolutely necessary,
Right.
So again, is it necessary to go to the park with your kids and play? Sure, especially since we've been, cooped up for so long. I think for their like mental health and stuff like that, it's a good idea. And again, it's an open space. They can run around and stuff like that. But for the store, for example, I don't think it's absolutely necessary for the kids to join you at the store. So I think that's probably a no-no. And until further notice. Yeah. Exactly. Unless you have no other choice and you kind of have to do the groceries and there's no one to keep them. Yeah. Just make sure that, you have your gel with you in your purse, because they're going to touch everything. So, mask, gel, and once you get home, first thing you do, you wash your hands really well for everything you've touched. And I think you should be fine. Yeah.
Okay. Thank you. That is great advice. A reminder to our folks watching at home that you can post your comments and questions right down there, and we would love to hear from you. But in the meantime, we have another question that came in. This is from Kathy. Kathy is asking another wonderful question that so many parents have. Do you have any good potty training tips or things not to do? Certain things to look for as science kids are ready or not? This is something I've been wondering too, Katie. Thank you so much for asking it. What are our thoughts, docs?
Training. So I have 3 kids and all 3 were completely different potty trainers. So I have been through all of them. The best advice I can give is that when the kid is ready, it's super easy. If the kid is not ready, it's like banging your head against the wall. It's going to be painful and it's going to just delay everything. So I would just wait until the kid is ready. They're pulling at their diaper. They're telling you they need to go to the bathroom. Any of those cues. And then you can always start, around 2, if you have a potty chair, you can always introduce and have them try to sit on it. The minute you hit resistance, though, you can't push them because the more you push them, the more they're going to go the opposite direction and they're going to start refusing. So it's really important to let the child guide the process, keep it very relaxed and low key, and lots of reward party time if they actually make a potty.
Yes, I completely agree. it is definitely, so eating, sleeping, and basically peeing or pooping are points of contention for toddlers. So they will use this as their weapons, because literally you can't make a kid go to sleep, you can't make a kid eat, and you can't make a kid poop if they don't want to. So this is their independent thing. This is what they hold on to have some degree of control over your relationship. So again, you have to be very relaxed about it and not make this a point of
struggle.
Yes, exactly. Not make this a power struggle, because it's going to backfire a lot.
The kid will win every single time.
Yes, there's no way you're going to win. I mean, it's a lost game from the beginning. So again, super relaxed. And again, if you feel that you're getting regression or you're getting a pushback, you take a few steps back. Take a few steps back. I usually say once the kid shows signs of interest, so like Dr. Nelson said, pulling at the diaper or telling you when they've done their function. So I pooped or I peed, things like that. So they're recognizing that now. I usually say start, if you're going to be home, let's say over a weekend, start pulling cotton underwear on. They're going to have some accidents, and that's totally fine. But at least what will happen is after the first couple of accidents, so be prepared for that, they will, because it's uncomfortable, they will start holding. So they won't just let it go whenever it comes. They'll start holding their pee and poop until it's the right time to do it. So cotton underwear on or naked around the house, bottoms off around the house, and then put them on the potty if they're okay, without too much resistance and stuff like that, if they're okay doing it, every couple of hours. So with that, what they're learning is, okay, I have to hold it, because otherwise if I don't hold it, it's uncomfortable. And then I'll let it go at the right time. And you're giving them those opportunities to let it go every 2 to 3 hours. So you're helping them be successful in that. Again, I usually say put a basket of toys or books or stuff like that in the bathroom. So make it a place that's pleasant to be in. And I usually that's the only time I allow a tablet, So I'm like, if they want to be a little bit on the tablet so they can relax and kind of let it go in the bathroom, that's okay too. So
and I was a pull-up fan. I use pull-ups with all of my kids. It really doesn't matter if it's a pull-up or underwear. If the kid is ready, they're ready. If they're not ready, they're not.
Yeah.
Wow, that's great advice. I think your advice about not making potty training a power struggle is something I need to get a sign made and put it in my.
It's just like Elsa, you gotta let it go.
People put the Live, Laugh, Love vinyl in their bathroom. I need don't make potty training a power struggle. They're on the wall in person. That's what I need. Boy, let's just keep this going. Angie is right there with us on this topic. She's saying, let's talk about poop with good news, right? With a 7-month-old. When is it too long to go in between pooping? And how do you get your little one to poop? What do you have for Angie?
If they are still nursing at this age, they may not poop every day. They may be still a once a week type of a kid. As long as it's soft, it's really fine to let it go. Now, the kid's probably going to get gassy. They may get uncomfortable. But if it's still soft, it's fine to kind of let things go. You can always try some prunes or some apple prune juice. There's one apple juice that's really good. It's called Simply Apple. It's really good for pooping. It has no added sugar. Any of those things will typically help them poop. But as long as it's soft, it's really fine.
I agree. I agree completely. Usually that's what I tell parents. I'm like, the frequency of pooping is because a lot of parents worry a lot about how often their kids poop. And frequency is important. So if it's been 10 or 14 days, that's definitely a problem. But we usually say up to 5 to 6 days is actually pretty okay. As long as the baby is, having nice soft stools and not straining too much or looking like they're super, super uncomfortable, their belly's super distended, things like that, it's actually okay. Some babies just don't poop that frequently, and that's totally okay. So I agree. I say a little bit of warm water mixed with a little bit of juice to stimulate the colon to kind of move things along. These things are perfectly fine to do. Yeah. And it doesn't have to be every day. They don't have to poop every day. Right. So yeah.
Okay, that's a great tip, and I think something a lot of parents wouldn't think of or know. So good information. Thank you. Keep those questions coming, friends. They can be poop or not poop related. We are here for whatever you need. Just post them down in the comments. One thing we haven't gotten from the public yet, although I'm surprised because this typically comes up for us, you've referenced it a few times, screen time with kids.
Oh, yeah.
what are current recommendations on screen time for children? What sorts of conversations are you having with parents about that? Now as we've got kids home, it is so much harder than it was even to control screen time. So what are your tips on that?
I think screen time during the quarantine time is kind of out the window. I mean, everybody had to just survive and do what they had to do.
Yes.
The AAP for a long time recommended no screen time for under the age of 2. Yes. I have to say that I didn't do that. It's pretty much impossible once you have more than one kid to keep them off of the screens. Right. And there's a lot of good educational things that you can find on iPads and stuff for babies. So I think their current recommendation is what? Nothing under 1, maybe?
Yeah, and I think less than 2 hours.
1 and 2.
Yeah.
Okay.
So, and again, I agree with Dr. Nelson. I didn't do that, especially, if you have more than one kid, it's really hard to do. Right. The quality of what they watch too is important though. So, so there's, in the world that we live, there's so many good apps and so many good shows and stuff like that they can watch, that they can actually learn some stuff about, through, again, personal contact and stuff like that. And, interaction with the parents is the best way to go always. That's kind of a given. But again, if it's creating more stress, so you have to pick your battles. If it's creating more stress and you're frazzled and you're exhausted and stuff like that, because you're committed and you're not using it, then that might create other issues. Right. So you have to kind of gauge, what your situation is. It probably shouldn't be your go-to all the time, to use screens, to do stuff like that. But, do it in a healthy way. I mean, again, pick your battles, make sure that you've exhausted your options and there's nothing else that you can do. And you're like, you've had it, you're up to here, then you need a break, so you can do that, but find something appropriate.
And a 30-minute little thing or a 30-minute little game is probably going to be fine. The best thing to do would be, like in our house, we have family movie night where we all are together, we're engaging, we talk about things. It's kind of a bonding thing. Totally appropriate. Now you can't park your kid in front of the TV for 4 hours a day. Exactly. That's not going to be good. So you need to have some interaction. You need to be able to discuss things. And I would probably put on the littler people, I'd probably say 30 minutes at a time and then do something else. Yes. What I do with my kids is I say, okay, screen times are done. Everyone go outside, and I kick them all out.
I love that idea. That's great. We've also prioritized, quality programming and trying to watch it together when we can, and that's helped. I think sometimes a more moderate approach, I'm with you, is a really, really great idea. Sometimes the risk of saying we're never going to watch it is that then when that fails, you just say, well, whatever. Then the kids can watch Pokemon all day. I mean, not to call out Pokemon, but so I think sometimes some moderate stuff can lead to some healthier choices. So great idea. Amy has a great question also about feeding. Let me get pulled up here. Amy says, when is it okay to cut back on nighttime feedings for a formula-fed 6-month-old? When is it okay to cut back on those? I think Amy probably needs to get some sleep.
That's a great question. I always talk about that as a 6 months. So a 6-month-old, you're at a crossroads with sleep, right? You're going to have a good sleep patterns and bad sleep patterns. And at 6 months, they can maintain their blood sugar overnight. They do not need to feed at night at all. But what's going to happen is they're going to develop a little habit of feeding in the middle of the night to go back to sleep. So it's really important to try to have them self-soothe as much as possible. And the best way to do that is the beginning of the night. You should try to get your kid to bed drowsy but not asleep, because then they can kind of roll over and get comfortable and fall asleep on their own. And then when they wake up in the night, they really should not be hungry. They should be able to adjust and go right back to sleep. If you continue feeding them in the night, it's not hurting anything to the child, except it's going to make sleep patterns a little bit harder later on.
I agree 100%. So basically what you're doing, what happens after 6 months of age is now they have the ability to self-soothe. So if you don't encourage that, you're going to get a kiddo that wakes up multiple times in the night, not for nourishment, but for because they need external soothing. So they haven't figured out how to do it themselves. So they need that external input from the parent. And so, you get immaturity of sleep, basically. So that develops. think of it as after 6 months of age, if you feed a child when they're waking up in the night, you're basically rewarding them for waking up. I mean, food is a huge reward for a 6-month-old. So you're basically encouraging them waking up in the night. They get two things. They get you and they get food. So that's a huge encouragement for them to keep waking up and getting those things. So again, you have to, and again, pick your battles. This is not an easy thing to do, but try to kind of start scaling back, especially if it's a multiple time a night feeder. I would start by taking one time out every week or so to make it kind of a smoother transition. But yeah, that needs to start being worked on.
Yes. I always tell people too, if you're holding your child to go to sleep and you're feeding them and they go to sleep, the way to think about it is if you went to sleep in your bed and you woke up in your kitchen, you would have to go back to your bed to go back to sleep. So you can't, however they fell asleep originally is how they're going to have to fall asleep again.
Yes.
So think of it in that terms. If you fall asleep, you're in your bed and you wake up in your bed, you're okay. You can roll over and go back to sleep.
Okay. Great tips. Thank you. Wonderful question from Mary. And folks at home, we have about 10 minutes left. So get your questions in. Oh, we've got a couple of them rolling in here. Let me go back to Mary's. Mary was asking about teething. Super important question. She says, any tips for an 11-month-old who is now cutting their first tooth, not taking a cool teether? Oh, I feel you, Mary. One of my kids loved the teethers. The other one didn't. Or cold washcloths to help comfort him or her, I should say.
Really, all you can do is Tylenol or ibuprofen. There's nothing you're supposed to put in their mouth anymore. It's really just supportive care. And unfortunately, if they won't chew on something, there's not a whole lot else you can do.
There isn't. And most of these things that are out there, like gels and stuff like that, are not FDA approved anymore. And a lot of them were recalled. So it's not, I never officially recommend any of these things because they're not approved. So again, you're kind of going back to Tylenol and ibuprofen if you're over 6 months of age, and I think that's pretty much all you can do.
I think ibuprofen works better. It lasts longer and it's an anti-inflammatory. So I really think it helps more with teeth pain than Tylenol does.
And they can try, cold teethers and cold, washcloths and stuff like that may be something that's unacceptable to this specific kiddo. But trying a mesh with frozen fruit or something like that might be a little bit more enticing because there's a flavor and a texture to it. So it might be something that, this baby would go for more maybe. So that's another suggestion. It's pretty much like a teether, but with taste, So something to try, maybe see if that will be more helpful.
Okay. Thank you. Good tips for Mary and the other parents out there. And again, we feel you, Mary. That's a tough time. Keep at it. Great question here from Katie. Katie says, my 17-month-old kiddo started back to daycare a few weeks ago after being home with mom and dad for a few months. Oh, so a big transition for this kiddo. He begins to melt down right around the time we get home at 5 o'clock through dinner, all the way to bedtime. Are there any good tips to help with that transition besides earlier bedtime, which we have done? He seems so sad and frustrated. Oh my gosh. And this is so frustrating. And I've been there too. What are your tips for Katie?
This is tough. And so one thing you need to remember is when the child usually is on their pretty good behavior all day. And then when they see the parents, it's kind of like their safe area and they will just completely melt down and let everything out. So it's nothing that they're doing wrong. It's just a circumstance. The kid has been really good all day and holding it in. And then when they see the parents, it's their safe zone. They feel okay to have a meltdown and just kind of let it out. It's an adjustment time. I think she's doing everything you possibly can. Good routines. If the kid can have a lovey or something at daycare, something that reminds them of home, that may help. Unfortunately, I think the only thing that's going to help completely is just time.
Yeah, is this kind of thing developmental? I remember 4 o'clock, 5 o'clock meltdowns being pretty common for that age.
Exactly right.
And again, and again, even without COVID or being, everyone's, isolated for this long and stuff like that, this is a common problem. And toddlers will have difficulties. I mean, naturally, they're at the age where they have, limited flexibility. They have difficulty with transitions. It's kind of my way or the highway kind of thing. So, they do. This is a normal, behavioral, issue at this age. Again, lots of understanding, lots of, loving and stuff like that. So they can kind of feel soothed and comfortable and things like that. But again, I think I think honestly time, because again, the transition period is hard, but once we get into a new pattern, then they're pretty good at following the new pattern. They are creatures of habit. So once they have a pattern set and they go for it for a while, they will resist initially, but then fall into that pattern and move forward.
And don't let it get, Katie, don't let it get upset. Don't let it upset you.
Yes.
You're doing everything you're supposed to be doing. It's just one of those things. So just relax, stay calm, know that it's temporary, and you guys will get through it.
Yes.
Oh, but docs, when they're that age, those big tears that they bust out, they will break your heart at that age.
We've both gone, with our kids, absolutely.
Oh man, they sure do know how to how to get us invested in wanting to make them feel better. That's exactly what they're supposed to do. But it is hard as a parent. We have a question from Katie, and final questions now, team. So if you have others, make sure you get those posted, because the docs will be logging off here to see their patients soon. But Katie says, is there an age where sippy cups should be phased out altogether, or are they okay to keep using as long as desired? When should you phase out the sippies?
If there's any rule about when you have to stop using them. If you don't like to clean up messes, then I'm fine with having a sippy cup. As long as, I really don't think there's because you can transition to a straw pretty quickly. I don't think there's anything harmful unless they're using the sippy cup all day long, and then you're going to have teeth issues. You're going to have some cavities, unless it's just water.
Yeah, exactly.
But other than that, I don't think there's really any hard or fast rule about it.
No. I would take the kids' cues, honestly, kind of what their skill level is. If they can sip out of a straw, great, you can transition to that. Or, when they're using the sippy cup, that they have, the both gross motor and fine motor skills to be able to do stuff like that, so they can transition even further. But there's no time window of time that they need to do that. They've got the skill, and you just kind of let them do their thing and give you the cues that they're ready to move on. And that's okay.
Great. Yep. And probably depending on maturity level too. My 5-year-old still uses cups with lids for the most part.
Yeah, absolutely.
Distracted, knocks over her milk at the table all the time.
Yeah, exactly.
Absolutely.
Yes.
I don't like to clean up messes, so
exactly.
Yeah, absolutely. Well, docs, that's all the questions I have in the feed, and we're just about time to wrap up. So are there any other issues we didn't get to talk about today that you think are really critical for parents, or just general thoughts you have about some of our messages today?
I think I would definitely make sure during this crazy time, we still need to get your checkups in. We still are here. We still want to see your kids to make sure they're healthy. And vaccines, of course, are important during this time. We don't want to hit, a measles outbreak or anything crazy. So I think it's important to remember to still get your checkups, still have your well exams. We're still here, and call us.
Yeah. And honestly, heading into the fall and winter time, I know we talk about this every year, but I think it's going to be a lot more important to do it this year. Get the flu shot in. It's going to be very important this year, because we may have an issue with having both flu and, coronavirus at the same time. It's going to be really hard to pick through all of it and kind of know what's going on. So I think at least protecting for the virus that we do have a solution for, that would be really nice. So
and if your kid comes down with flu and COVID, they're going to be twice as sick. And it's going to be a very scary situation.
Okay. Well, that's wonderful advice. Again, we were joined by Drs. Nelson and Grammatikopoulou from Pediatric Associates, very generous sponsor as a practice of the Discovery Center, and especially some of our programs for at-risk kids. So we are deeply grateful to them for their long-term support of the Discovery Center, but also being with us today and giving us some of your very valuable time to answer questions. Thank you so much. This is being recorded, and so if you didn't get the chance to tune in live, you'll still have the chance to do that. And of course, we have lots of great activities for you to do with your kids at home, and more great information sessions just like this that you can access on our website at kansasdiscovery.org/home. So please feel free to join us online for more great resources. And in the meantime, we will sign off for now. Thank you, doctors.
Thank you.
Nice seeing you guys. Bye.